So next presentation is by Dr. PRITHVI Chandrakanth, and he'll be talking on research opportunities. And he is currently a surgical retina consultant in Aravind Eye Hospital.
Thank you, Rakhi, for the introduction. Sorry for the glitch, and I'll be talking about research and publication. So, as a resident, we are always told about these three things: write exam and pass, attend conferences, CMEs, and also expect you to research and publish. But the only thing that you actually end up doing is exam and pass. Write an exam and pass. That's the only thing we actually do, and in between maybe CME conferences again, but not that important. You don't give that much of important. But actually research and publication is very, very important, because whatever you read and write in the exam is the result of years of research and publication. So whatever you are reading and writing is a result of years of publications and years of research, which has been concise and given in a textbook, so that it benefits the patient and the doctor. So basically there should be an interest in doing the publication or the research. Otherwise it will just die off. You won't complete it. You won't have the passion to do it. And once you develop an interest, you can even talk to people who are like-minded and who have published earlier. And that will give you the push to actually start your publication. And once you start reading more article, you know what is out there, and you know what is the void or what is missing, and hence you can actually find those things and try to make the publication or research. And always start, you can start it from making a letter to editor or a case report, and get a hang of how to write a publication article, rather than just going initially to an original article. So you can start slowly by having because letter to editor in IGO is 300 words, so you can actually write it'll more easier to write, and you can understand the process of submission, and then you can actually go for the larger studies and original article. And having a name in an article is a big motivation factor. The first time I saw my name in a publication, it actually felt so nice, and I got the motivation to do more articles. And this was the first article which got published of mine. And yeah, so the subject, so what happens is, what the mind doesn't know, the eye does not see. So you need to know what is there outside, what is there in the literature, so that you can differentiate with the what is good for you to publish. So if you want, you can always write exams to keep yourself updated with the knowledge, with what is happening in the real world, and that will actually help you to know what is not there. And when you see something what is not previously described, it will strike you that you need to get this published. So that you need to have a good sound of the subject. And then the mentor. So mentor is one of the most important thing in your life, because that person will push you to publish no matter what. He'll help you when you're having trouble. Even if you have the starting trouble, he'll give you that push which you require to start with. And he can be the best reviewer. So if you write something and you give it to him, he can review it, and he can tell you those changes which you wouldn't have thought about. And because of his experience, so he'll be able to do that because of his experience. And he'll also tell you how to answer queries which come after your article is reviewed. So he's the one. So for me, it was Dr. John who has helped me with all my publications. Even yesterday, I had a talk to him, because I had some issue, and I had to speak to him. So he's always there for me, approachable. So you should find a mentor who could actually push you. And also while doing a publication, now you know that there's some void, and you know that this is not there. So you should ask if there's a good question in that article that you want to publish, and find enough and more literature and any other review articles which has these things or not, and then only go ahead with, because you cannot sit and write something which is already present, so that there is no novel thing added to the existing pool of knowledge. And when you see any case that is very different, a rare case, or you better do all the examination, all the documentation, all the findings, take images, because now we have multimodal imaging system, we have lots of OCTA, OCTA, FFA, everything. You may do it and keep it, because sometimes when a query comes, you don't have few of those images, and then it goes off like that. So and one more important thing is to have a consent of the patient. So that is something which all publications ask. And having a basic knowledge of statistics will help you, even though if the complicated ones you can get it done by a biostatistician, but basic Excel and basic statistics you should be able to know, because it will help you a lot in writing the discussion. And भैया excuse me, हाँ इसमें भी नहीं आ रहा, नहीं अरे ये. And writing the manuscript, write small paragraph daily and refer a lot of articles to find out how to write these things. And never copy paste anything. Try to write it manually, because if you copy paste, there are some softwares which can actually sense it. And setting targets. So once you think about writing an article, you fix that 1 week I'm going to take, you should take 1 week, not more than that, because if you don't set a target, you will just keep delaying it. And softwares like Grammarly and Zotero helps you a lot in increasing the efficiency of your publication. And ask which journal you want to put, and these are the factors which you have to see if your question can be answered and can be published in which journal. So there are few journals like IGO promotes innovation, but I don't think there is ESCRS, Europe journals actually don't publish innovations very easily, but they like more of validation of new instruments. So all those things can be actually seen by going through their website, which one accepts what kind of publication. And always have these things ready. So write an article in this format, so that you can just interchange things according to which journal you are going to plan to put it in. And then having a proper ethics is very important. Having please get all these things done. One thing is plagiarism. Get your article checked for plagiarism, and there should not be any conflict of interest. Get it all signed beforehand. Even authorship criteria and the order of authorship should always be priorly determined, because then there should not be any conflict of interest later. And yeah, even copyright form has to be done even beforehand. And it is always a teamwork that gets this thing published. So one person, it's very difficult. Get a team who can help you with all these things. Thank you.
Prithvi, I do have a doubt. Like sometimes it is a paid journal, or the images has to be paid. So what you do about that? You take it on your own, or the institute pay for that?
See, if your institution is willing to support you financially, like now I work in Arvind, so when I publish an article, they are willing to support me financially up to a certain limit. So when I publish something in IGO, it would come around 10 to 15, something between that, and they are ready to do it. Something maybe other journals, maybe international journal, ask more finance. So that time what happens is they'll give this much, then the rest of the thing you'll have to put it from your pocket. So that depends on each institution. So that whichever institution you're working with, they'll have a set rules that they can support you with this much finance. So that is so that will be done by each institution. It varies actually. Otherwise, you'll have to take it from your pocket. Yeah.